I'm a professor of medical oncology at the University of Nottingham and a consultant medical oncologist at Nottingham University Hospital. Besides being a very active and a busy clinician, I lead a research laboratory at the Biodiscovery Institute in the School of Medicine. We are focused on translational cancer research. I've been a head of service for oncology, NHS divisional lead for cancer previously. Cancer is primarily a disease of the genes, and genes are sequences of your DNA, and all of us have DNA in our cells, okay, including tumors. So the whole aim of genomic testing is extract the DNA from the tumor and understand whether there are certain alterations in the genes of these tumors. So genetic testing or genomic testing primarily is to match the alterations in the genome to a specific treatment that may be available to treat this particular type of cancer. Primarily focused on ensuring that genomic testing is widely available for our patients, for our community here in the East Midlands. We really need to work with our local cancer partners, and in fact now we have a joint strategy with East Midlands Cancer Alliance, and the strategy really is looking at how do we ensure that our cancer patients in this part of East Midlands actually have access to genomic testing. How do we improve the access to genomic testings? How do we make healthcare professionals aware of the availability of these tests that they can request in clinic? So it's a huge challenge, but we are working towards it, and hopefully over the next several months we will have this streamlined, efficient service for every patient who comes into a cancer center in the East Midlands. We need to understand what is the genomic profile of the tumor that makes this tumor particularly suitable for a precision medicine approach. So as oncologists, we are now routinely using this in clinic. So 10 years ago, we never had these options, but 10 years hence, thanks to all the advances in genomic medicine, we now have these treatment options available for patients, and these treatments actually make a real impact with regards to improving survival of patients as well as improving their quality of life. Whether you're a health professional in the primary care or the secondary care or in the tertiary care centers, genomic medicine, genomic testing is here to stay. If anything, it's only going to expand. The reason why I say this, that many of these genomic testings, they're going to have applications not just in patients who have established cancer where you're trying to give a specific treatment. It's going to be also playing an important role in prevention of cancers. And at the same time diagnosing cancers early and picking them early. So across the spectrum with regards to detection, early diagnosis, prevention as well as precision treatments, genomic medicine is here to stay.